Hello friends, I am Dr.pavan Kumar, consultant cardiac surgeon and head of the department of cardiovascular surgery in Leelavati Hospital. I've been practicing heart surgery in Mumbai over the last 32 years and I've seen thousands of heart patients. And during this period, I came across with many questions which patients usually ask about heart surgery. So I wanted to answer some important 5 questions which I selected from these discussions between patients and me and patients and with other doctors. So first question which came to my mind is that should you seek an opinion from heart surgeon about your heart disease? A very important question which I want to discuss with all of you, that all heart diseases are being treated presently by cardiologist and our physician, but they do not have that surgical point of view, whether when a surgery is required or surgery is not required, or how this patient can be managed without surgery. These are all the important points for management of a heart disease, whether it is a coronary artery disease, or it's a heart valve disease, or it's a heart failure disease, or it is a congenital heart disease. There are many varieties of the heart diseases which also require surgical intervention or surgical treatment. So it is always better to take an opinion from a heart surgeon if you have a heart disease, so that you have different perspective of management of that heart disease. What is the timing of a heart disease surgery, and what is whether you require heart surgery or not. These are the important points which you should be, that will enlighten you about the management of your heart disease. Second question is usually patients ask is that if I visit a heart surgeon, next thing is surgery. I mean, that's a very logical thinking patient thinks about, that any heart surgeon will always suggest for heart surgery. It is not so. 90% cases are usually managed by medical management or interventions like angioplasty or valvular interventions and like that. Only 10% patients like coronary artery disease, where you require coronary bypass surgery in a triple vessel disease or left main disease or something of that nature. Especially if advanced stage of heart valve disease, then you require a repair or replacement of heart valve disease. Many a times it is managed medically or conservatively. So that is the answer of your question. Now third question usually patients have in their mind is that, is my body fit for heart surgery? Very important question. Whether if people have various diseases like diabetes, they have asthma, their age is on that side or beyond 70. It's a very important question, whether my body is fit for surgery. But let me inform you that nowadays with the latest technology, ICU care, operation theaters of latest variety, and all investigative technologies available to us, anybody who can undergo heart surgery safely as a normal fit person would undergo. So that is important, especially in a patient who is even after 75 years, the patient has a diabetes, patient has had a stroke. All these the complications or risks present in your body can be managed according with simultaneously heart surgery can be done. Now fourth question is that almost all patients ask that, is heart surgery dangerous? No, it is very safe. Answer is, it is very safe. And heart surgery, like I have done last now 3 years or so with 100% success rate. Any kind of heart surgery, whether it involves the risk factors, it involves the comorbidities, it can be taken if you have a good center, advanced care available, and at the same time all kinds of specialties under one roof available with expert surgical skill. Heart surgery is very safe. Lastly, I will discuss that the questions are asked is that how heart surgery helps in alleviating the conditions, the removing the disease or complaints. Yes, very important question, that heart surgery is meant to remove the common complaints like chest pain in a coronary artery disease, or breathlessness in a heart valve disease. A person has had a heart tumor and has had a stroke, different variety of embolic phenomena. If tumor is removed, then is almost cured. So these are the certain, and like congenital heart disease, if congenital heart disease surgery is done, 90% cases person is cured of heart disease. So these are the things which is very safe now, and it alleviates the complaints and the condition completely, in whatever nature of heart disease person has. So these are the certain important points or important questions which usually patients have in their mind. Next time we will discuss more 5 burning questions patients have in their mind about heart disease management. Thank you very much.